Cool.
Alrighties, welcome. Today, as a part of Certificate 3 in Pathology Collection, you're all going to be learning medical terminology, which is another language in healthcare. Professionals use it worldwide, no matter what language they speak. It's a universal language in healthcare that enables clear and precise communication. Now, it's important to understand and know medical terminology. It allows accurate understanding and use of terms to prevent miscommunication that could lead to medical errors and compromise patient care. So especially when you transfer between patients. It facilitates ambiguous dialogue among doctors, nurses, and all other professions, ensuring everyone is on the same page. So there's a lot of communication between all the staff members. It's essential for precise record keeping, which is vital for legal purposes, insurance, medical records, and continuity of care. Proficiency in local language demonstrates competence and professionalism, fostering trust with colleague and patients. I'm gonna go here, I can't read my laptop, sorry. Standardized terms allow for quick, effective sharing of medical information across different departments and institutions. So it's just about giving information across really well and accurately, and forms the foundation for understanding medical literature, participating in research and continuous professional development. If you're a scientist, you don't only work in the industry, you work all over the world. So you all have to have common language together as well. Now, there is also anatomy to medical terms. Most medical terms are composed of standardized parts, primarily derived from ancient Greek and Latin, which allows for a systemic approach to understanding their meaning. So, usually, the way you'd see a medical term is there's a root word that everything else is built around it. And the root word is the fundamental meaning of the term, often referring to a body part, organ, or action. And before the root word, sometimes you'll have a prefix, and that modifies the meaning, which indicates a location, number, or a time. And then at the end of the root word, which you'll always have, is a suffix. And that will alter the meaning again, often describe a procedure, condition, or disease. So you see at the bottom, we have an example here. You have hyperthyroidism. Hyper is excessive, thyroid is maybe the thyroid gland or the hormone, and ism means condition. So it's hyperthyroidism. Production of too much thyroxine hormone, which is from the thyroid gland. Now, word roots are the fundamental meaning of a medical term, often referring to a specific body part, organ, or action. Most medical terms have one or more root words. That can happen. These roots are the core components around which other elements are built, suffix, prefixes. So we're going to go through it together. For heart, that we always talk about, in the medical world, we say cardio, example, cardiology, the study of the heart. Liver is hepato, so all of these are Greek words, by the way. So if you're Greek, you'd know this really well. That would mean, so an example is hepatitis, A, B, C, D, or E, that's a disease, which is the inflammation of the liver. And then for foot, you have ped, or PD, or pod, so bipial gait, podiatry, pediatrics. Ped can also be quite interchangeable because it can also mean like pediatric surgeon, someone that works on children, pediatrician. And then you have osteo, which means bone, any bone. So that can mean osteoporosis, which is the breaking down of the bone. Usually you get it at older age. And gastro is the stomach. So think of gastritis, which is the inflammation of the stomach. Or in gastric acid. And neuro, which is a nerve right there, a nerve cell. Think of neuropathy. And then hemo is blood. So think of hemochromatosis. Hemochromatosis is when there's too much iron in the blood. That can actually happen. And then entero is the intestine. So that's the large intestines and the small intestines. So that can be gastroenterology. So gastroenterology is stomach, intestines, study of. And then pneumo is lungs, so pneumonia, lung infection. And then for the eye, you have the ocular, ophthalmal, and ops. So obviously, you can also have a dozen or a few root words for one single thing. It can be interchanged. So oculomotor, ophthalmology, or optometry, and these can be either Greek or Latin. Also, if you check your email, I sent you handouts as well. We're going to need for the quiz later. Thank you. So this session is actually going to be quite word heavy. I'm sorry, but this is what you have to do to work in this industry. So you're all going to have to go through what I went through. So we're going to learn about the suffixes today. Every root word has to have a suffix, and it often describes a procedure, a condition, a disease, or a part of speech. So ak, ik, al, os, or tik is related to or pertaining to. So cardiac bypass surgery, gastric bypass. There's no such thing as cardiac bypass surgery. That was gastric bypass, sorry. Cardiac arrest, that's the one. And then ent, or ist is person or an agent, so that will be a dentist. Dentist. Teeth, ist, person who works on teeth, your dentist. Then pathy is the disease, so neuropathy, a disease of the neuron. And ology is the study, so biology, study of the organisms. And then gram, think of it, so it records something. So mammogram, that records the breast tissues. It can see if there's any cancer in there from the x-rays. And then you got graphy, which is the process of recording. So think of ECG, electrocardiography. Then ick is pertaining to, so that could be gastric acid. There we go. And then ein, again, it's pertaining to, so there are different suffixes for the same meaning. So into urine. Then algia is condition of pain. So arthralgia, takes a bit of time. Then scission is process of cutting. So incision, doctor makes an incision. Ectomy is the removal, the excision or cutting out. So it's removal. So appendectomy, when you have appendicitis, you have to get your appendix out. There's no other way to deal with it. So you have to do an appendectomy. Then tomy, just make a note of this from the ectomy. It's the process of cutting into. So it's not the removal, it's getting into something. So craniotomy, it's cutting into your skull. Then is the structure, so pericardium or sternum, that's one. And then the E, the Y, is process or condition, so dysentery. And then ism is a condition or a process, which is hypothyroidism or hyperthyroidism, like I said before. Then itis, remember this one, inflammation, you'll see it quite a lot. So arthritis, hepatitis, that kind of thing. Then lysis is the breakdown or separation. So dialysis. Dialysis is a process where someone is hooked up to a machine and their blood is run through to remove any waste products because their kidneys have failed, and that is usually used to remove any of the waste products from the blood. So they have to get on dialysis to separate the waste material out. The mission is to send, so remission. Remission is a term you'll see in cancer. So when somebody's basically tumors are gone or nearly gone, the doctor will say, oh, you're in remission. So that's a really good thing to hear. And that's what everybody loves to hear. So, and then mortem is death, so post-mortem, so post-mortem autopsy, after death. And then oma is tumor or mass, so hepatoma, so that's a tumor in the liver, hept. And then opsy is to view, so biopsy, arthropsy, that kind of thing. Then osis is abnormal condition, nephrosis, abnormal condition of the neuron. Os is pertaining to, so intravenous membrane. Partum is birth, so antepartum, postpartum. Then pnea is breathing, apnea. Then rhea is flow or discharge, so rhinorrhea, so it's when your nose kind of runs a little too much, maybe you got some allergies going on. Then scope is an instrument to visually examine, so laparoscope, arthroscope, yeah. Then scopy is the process of visual examination, so colonoscopy. Pretty much the same as scope as well. But that's the process, not the instrument. Then section is to cut, so resection. Then is a state of, so prognosis, what's your state right now. Then status is to stand, to place, or to stop. So metastases, so that actually means when something has moved to different parts of the body. So the cancer tumor has metastasized. So that means the tumor has migrated from where it originally was from, let's say from the liver to the brain. So it's metastasized. And that's usually a bad thing as well. Cool. Now we're going to the prefixes. This one, you all will be pretty familiar with. So we'll go through it again. So, we'll go through it together. A or an means no or not. So anemia. Pretty familiar with it? It means no iron in the blood or very low iron in the blood. Aut is itself, so autopsy. So auto, think of that. And then dia is complete or thorough, so a diagnosis. What's the complete view of this thing? And dis, we've seen that before, is bad, difficult, abnormal, so dyspnea. Endo is within, so endoscope, within the body. Exo is outside, so exocrine. Then hyper is that's a familiar word. It's too much, it's excessive.
Oh my God, that's too much.
That's what you gotta learn. That's what you gotta learn.
Too much to remember, yeah?
You have to learn that, all of you.
Yeah.
Hypertension, so a lot. And then hypo is too little, less than normal, hypotension. Hypo. You gotta be careful with those words as well when you talk to somebody about it because they can get a bit confused. Hypo. Yeah. Intra is within, intravenous membrane. Then peri is surrounding, so pericardium, that's just something that surrounds the heart, protects the heart as well. Then pro is before, so prognosis. And then re is back, so reverse or resection, which means to take things apart. And then retro is behind, so retroperitoneal, that's another weird structure of the organ. Then sub means below, like submarine or subhepatic, so that's below the liver. And then trans is across or through, so like transdermal membrane or transparent, if that helps. And then you also have prefixes for the amount of the quantity of things and even the number of things. So oligo means few, so oligurie, that actually means you have very little urine. And then poly, which is, many, we all know that. So polyuria, that means you have too much urine. And then there's tachy, that means fast. So tachycardia, you have a fast heart rate. And then there's brady, which is slow. So bradycardia, very slow heart rate.
So is it bad? Like
both are bad.
High is
Both are bad. Both are bad. It should be normal.
Should be normal.
You see
is
that?
there a word for normal as well? Normal is just normal?
Yeah, normal heart rate. So
They just say normal.
I think there was one. Forget about it.
Okay,
I'll remember later. Mono, like monopoly, is one. Monocytes, that's like one cell or one lobe. And then bi is two, bipedal gait, which means you walk on 2 feet. Hemi is half, which also can also mean one side, so half your side, which is hemiplegia. Multi is many. Multimorbidity. Multimorbidity means you have a lot of chronic diseases. Yes. Nulli means none. Null. Nulliparous, which means you've never given birth. And then, so all men are nulliparous, I guess you could say. And then quad is 4, pretty easy. Quadriplegia, someone who is... I know, right? Quadriplegia, you can't move your 4 limbs. Semi is like, same membrane is half, so semilunar valve, that's it within your heart. If you're in my heart lesson, you know about that. Tri is 3, so tricycle, think of tricuspid valve, again, another valve in your heart. And uni is 1, unilateral. That's pretty right. So prefixes obviously have like a direction or a placement, as you can see. So in the medical world, you have to be familiar with how we talk about axes and spatial perception. So you might in the normal world say front, but we say anterior or ventral. So here what I'm trying to tell you is, when you look at the body, it's like a ship. You have starboard and port, was it? Yeah. The same we do with the boat, with the human body. So the front is anterior or ventral, and the back is posterior or dorsal, so what's behind the person or behind a certain organ. Then caudal actually means closer to the torso, so towards the torso. Think of caudal or like cord, that's your tailbone. And cephalic is towards your head. So maybe the tumor has metastasized cephalic, so it's going towards your head. gone up. And then anything above your head or above a place is called superior. So think of a king, the first top of the chain. Then anything underneath your body or underneath an organ is inferior. And then, so that's kind of your axes right there. Now, then you have proximal. So proximal is when something is closer within you. So say your knee is more proximal than your feet. It's closer to the body, to the torso. Whereas the feet is distal in comparison to the knee, See, it's more further away. That's how we would say it. And then you have medial and lateral. Lateral, again, is like the side view. So proximal distal is up, down. Medial lateral is left, right. But medial is more like, again, in the middle of everything, so close to the torso. Lateral is on the outside. So if you've ever seen a knee anatomy or know about ACL or MCL, or I don't know if you watched the game on the weekends, one of the players ruptured his MCL, medial collateral ligament. So that was the ligament on the inside of his knee. The outside of the knee is lateral collateral ligament. And yeah, that's how you talk in the medical world in terms of axes and spaces. Now, when it comes to creating these words together, you actually need a combining vowels. And that's typically an O. And it's used to facilitate the pronunciation. It connects the word parts just like and or of the. So, for example here, cardiology, study of the heart. And the rule is it's used between root and root words, so gastroenterology. And it's or root and suffix, just like cardiology. When the suffix begins with a consonant, not a vowel. It's not used when the suffix begins with a vowel. So look at hepatitis. The suffix is itis, that has a vowel, so it's just hepatitis, not hepootitis. And nephrectomy, again, a vowel, so in ectotomy, that's, no nephrectomy. All right, so if it's a lot of words to remember in the medical field, so the way to go about it is not to remember it, but maybe not to remember the whole word, but to deconstruct it. So the approach is simple. It allows for interpretation of complex words by recognizing familiar components. And you do that by starting with the suffix, so the end of the word. So you begin by identifying and defining the suffix, which is located at the end of the term. The suffix often indicates a procedure, condition, or a disease. So if we look at the example of cardiology, ology, study of, that's a suffix. Then you identify the prefix next, which is at the beginning of the term. And again, that indicates location, number, or time. And then you determine the root word, okay, the word that makes up the whole thing. And that usually is like a body part or a system. So in the case of cardiology, cardi is the root word, and that means the heart. And then you combine the meanings together. So we have ology, the suffix, study of. Then you have cardi, heart, study of the heart. You can also build medical terms as well, deconstruct them and construct them. And first what you do is identify the core meaning. So the root word usually, determine the primary subject, usually the body part and its corresponding medical word. Then you identify the condition, which is determined by the medical suffix, which describes the condition, procedure, or disease. Then you combine these parts. So you join the prefix, root, then the suffix, and add the combining vowels if need to be. So inflammation of the liver, you identify the core meaning. Liver, that's the body part. So that's hepat. Then you identify the condition, the suffix, that's inflammation, that's condition. Itis, inflammation. There's no combining vowels because itis already has a vowel, so it's hepatitis, inflammation of the liver. Cool. So we're just going to go through some together on the cardiovascular system. Cardiology, we already spoke about it. Cardi is heart, ology is study of the heart and its diseases. Tachy, we said it was means really fast. Then cardia is heart, and ia is condition characterized by rapid heart rate. Then electrocardiogram, ECG and EKG, just a note, EKG is added because apparently in the US, they find it, they can misunderstand EEG, which is something you put on your head to measure your head, and ECG. So now over in the US, they say EKG or EEG. They don't say ECG over there anymore, apparently. So again, electrocardiogram, electrocardiogram. Gram is recording with the and that records the electric beats of the heart. So it's a record of the electrical activity of the heart. There we go. Then you have angioplasty. Angio, that usually means like arteries or blood vessels, and plasty means to repair, like plastic surgery. So there we go, surgical repair or unblocking of the blood vessel, especially a coronary artery. So that's usually done like after a heart attack, because that means like there's no supply of blood to the heart. Then in the digestive system, you have gastroenterology. We went through that before. Gastro is stomach, entero is intestines, ology is a study of the stomach, intestines, and associated diseases. Dysphagia, dys means difficult or painful. Phagia means swallowing, difficult or discomfort in swallowing. There we go. So appendectomy, so we've got our root word append, so appendix, and an ectomy, which means a surgical removal of the appendix. Then hepatitis again. Our root word is hepatitis, then itis is the inflammation of the liver. So you can see no matter what system you go to, body system you go to, it all interchanges. The language system is still the same. So if you go to your handouts on your email, Rizwan,
Yes.
if you go to your email, I sent you handouts. We're going to do a quiz. Is that the one I gave? No. It's under my name. There. There's an attachment. Medical terms handout. Yeah, that's it. Medical terms. If you go to medical terms handout, that's basically 3 slides that I've just presented. Obviously, I don't expect you to remember everything straight away. If you do, oh my god, amazing. Let's go do some poker later. Okay? We're gonna build some terms together. So let's say somebody has a heartburn. Okay, pain in the heart. So our root word will be the body part. So that's heart. What is the Latin or Greek word for heart?
Cardi.
Cardi, good. And a pain. What can you see? Look in your suffix. Because it means a condition, a pain.
Algia.
Algia, very good. So together, what would that be?
Cardialgia.
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 Cardialgia. Very good, Erin. All right. You know, Rizwan, you're going to get this one.
Yeah.
Let's say somebody has low blood sugar level. Okay, our root word would be something like sugar. Okay? Sugar. What would, I don't think I've listed that in there, so I'm just going to give it to you. That would be like glucose or glycogen, you know? So low, do you remember in the prefix what low was? Quite a common word. It's in your... Hypo, very good, yes, very good, hypo. And blood, I don't think I've listed on that there in your handout, sorry, it's emia. So it's hypoglycemia. Hypoglycemia, that's how we say it, low blood sugar level, very good. Now, you guys are gonna break down some terms. What is a lobectomy? What is it? Okay, let's go for the root word. What is lobe? What do you think the lobe is? Yeah, you can't need a lot of nanny for that. Lobe is actually a lobe of the lung. Okay? So what's ectomy? That's actually in your handout. That should be in your
Removal or excision.
That's it. So that then together, the lung lobe and removal of, what would it be together?
Cutting out a part of the lung.
Yep, okay. Yeah, there we go. The surgical removal of the lobe of the lung. They usually do that if someone has really bad, like dead lungs, you know, or they have tumors in there. Next word, bronchitis. That's quite common. Bronch. Maybe nobody knows anatomy that well. That's the bronchioles. It's a part of your lungs, actually. It's a smaller part of your lungs. But what's itis? I think we've seen that before, haven't we? What's itis? What would that be? Go back to your handout. What's itis? It's in your suffix.
Yep.
Maybe I should put in alphabetical order next time. Sorry.
It's not there.
Itis.
Here,
Yes,
on
yes.
the other side.
Yes, so what is itis again?
Inflammation.
Very good. So we have bronchies and itis. So that is, yeah, bronchies and inflammation of the bronchi. Exactly. That's in the lungs again. All right, this is going to be a fun one. Sphenopalatine ganglion neuralgia. What do you think that is?
Yeah, this time.
Do you think, okay, is there any words familiar to you on there? Sphenopalatine ganglion neuralgia.
Neuro, so there's a nerve.
Good, good.
Yeah.
Any other familiar words in there?
Is that like the liver or something?
No, not the, it sounds like spleen, but it's not.
That's probably where my brain's going.
Palatine ganglioneuralgia. Any other guesses? Maybe algia. Can we guess what that one is, or can we take a look? What's algia?
Is it a prefix or suffix?
It's a suffix. It's at the bottom.
LDL. Condition of pain.
Condition of pain. Very good. So I'll go through it with you. Spheno, it means sphenoid bone, which is in your skull, at the base of your skull. Palatine is palate, which is at the bottom of, the top of your mouth, the roof of your mouth. And ganglion is actually your brainstem back over there. Neuro is like with the nerves, and algia is pain. So it's pain of the sphenoid, palates, and ganglions. It's brain freeze.
Huh.
It's brain freeze. That's what it means. That's how we say it.
So next time I fell asleep too fast,
Yes.
for some reason I've found, and I've gotten older, I'm more prone to them. I've got sphenopalatine ganglion neuralgia.
Exactly. Don't ever say brain freeze again. That's for children.
Yeah, it is.
Gosh. All right. Last one. You guys have to really do well in this, okay? If you do, I'll give you all $10. What's this? Pneumo
That's a fun one.
ultra microscopic silico volcanic
Can I take a
onychonosis.
guess?
What?
Asthma.
Yeah, because it's going to be something really simple, but pneumo was lung.
Good. Ultra microscopic silico volcanic conosis.
Small lungs. So that's lungs.
There's a volcano in there.
Okay. Yeah, there's a volcano inside there.
Doesn't sound very pleasant. And microscope.
This is the first time ever in our life I heard.
I
that
know,
word
right?
from
Imagine
a-
doing that in a spelling test. Can you figure any other words out from there? Can you pick at it? Maybe a little bit, dissect it. Pneumo, ultra microscopic
Is it,
silico-volcanic gonosis.
Not collapsed lung.
Osis was an abnormal condition.
Mm-hmm.
Oh, no, I was going to say cystic fibrosis, but that
No,
would
no,
be-
no. So we know it's to the lungs, then it's ultramicroscopic silico-volcanicosis. Any other guesses? Can you break it apart by any chance?
I've got micro like lung and microscopic, so that's why I thought asthma. Yeah.
Anything else you guys can break apart?
What's silico?
No? Yeah? No? There's one? Anything else? Okay, let's go through it together. It's a lung disease from inhaling very fine ash, sand, silica
Oh.
dust.
So it was what it sounded like.
Also known as silicosis or the black lung. It's actually a occupation disease. So
Yeah.
a lot of, I think this was in New South Wales, but a lot of people used to grind this.
Asbestos. Like that's
Asbestos or the the marble.
Yeah.
Yeah.
marble
Yeah,
stuff.
they stopped doing that
Yeah.
now because
Yeah.
of this condition. Or people who are in volcanoes or firefighters, they actually have this condition right there.
Oh.
Yeah. And that's how it's broken down. Pneumo, lung, ultra, extremely, microscopic. Silico, silicon volcanic, from the volcanic ash or dust, coniosis condition.
Oh.
So that's what it is.
So none of us got $10.
Oh, I'm sorry, guys, not today.
You thought that was a safe offering.
All right, in conclusion, medical terminology forms a structured universal language in healthcare built upon the systemic combination of roots, prefixes, and suffixes. This foundational understanding allows for precise communication and accurate documentation across all medical disciplines. Continuous practice and engagement with these terms are crucial for healthcare professionals to achieve fluency and maintain competency. This knowledge ultimately enhances patient safety and care quality, forming the foundation of effective healthcare delivery. It's a great thing to learn because, of course, clinical documentation, communication, medical literature, and professional development. And remember to always, if you're continually engaging with medical terminology, as it's essential for healthcare professionals to maintain competence and enhance patient care. So that's the end of the start of medical terminology. Next time, just a preview, we're going to be talking about medical abbreviations. That's another language we're going to learn. It's going to be great. So you thought doctors' handwritings were bad. Wait till you get to learn this course. All right, we're done. Thank you.
Thank you.
Thank you.
No worries.
I did my first social work placement in a hospital,
Oh, yeah.
Footscray Hospital
Oh,
actually,
yeah.
for 3.5 months. And this would have been really helpful before I started.
I know what you mean, yeah.
It's like, oh, this is actually helpful. Like,
It's a whole different world. Isn't
yeah,
it?
a different language.
Mm.
Okay, so we're going to that room.
Yes.